Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to our webinar where we want to explain the processes that we have at Al-Falah College with regards to COVID-19. On behalf of the board and the principals, we say Assalamu alaikum wa rahmatullahi wa barakatuh to parents, learners, and our educators. We hope to have a presentation of probably just about an hour in which we will give you clear guidelines as to how the school is operating and hopefully allay many of your fears, as well as share with you some of the advice and guidance that we'd like to provide. Alhamdulillah, we have two special guests with us, Professor Yunus Moosa and Shaheen, our head of our task team, will introduce you to him a little later, as well as Dr. Manjra, who will be giving us much of the information that we hope to find some benefit from. Our program is as follows. We'll commence with the Qiraat. I'll then hand you over to Shaheen, who will chair this whole program, and he will then introduce our guests. We'll discuss the various scenarios that can take place at Al-Falah College and how we intend dealing with it. And at the same time, our guests will advise us accordingly. Some of you as parents have sent us some questions. Unfortunately, this platform doesn't allow us to take questions, but we have those questions on hand and we will answer them. And then we will conclude with our final comments and a closing dua, inshallah. So with that, I hand over to Maulana Mullah, who will commence with the qira.
السلام عليكم ورحمة الله وبركاته. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. يا أيها الذين آمنوا اتقوا الله ولتنظر نفس ما قدمت لغد واتقوا الله إن الله خبير بما تعملون. ولا تكونوا كالذين نسوا الله فأنساهم أنفسهم أولئك هم الفاسقون. لا يستوي أصحاب النار وأصحاب الجنة أصحاب الجنة هم الفائزون. لو أنزلنا هذا القرآن على جبل لرأيته خاشعا متصدعا من خشية الله. وتلك الأمثال نضربها للناس لعلهم يتفكرون. هو الله الذي لا إله إلا هو عالم الغيب والشهادة هو الرحمن الرحيم. هو الله الذي لا إله إلا هو الملك القدوس السلام المؤمن المهيمن العزيز الجبار المتكبر سبحان الله عما يشركون. هو الله الخالق البارئ المصور له الأسماء الحسنى يسبح له ما في السماوات والأرض وهو العزيز الحكيم. صدق الله العظيم.
Shukran, Maulana. Jazakallah khair. I now hand you over to Shaheen, who will continue with the rest of the program. Over to you, Shaheen.
Assalamu alaikum wa rahmatullahi wa barakatuh. And Jazakallah, Mr. Muhammad. Respected parents, teachers, our esteemed guests, and my fellow students. In light of this pandemic worldwide and the fact that our lives have been disrupted by this pandemic, the COVID task team at Al-Falah College have been working around the clock to make sure that all the necessary steps were taken to ensure the well-being and the safety of every individual that steps onto our campus. We have also taken into account as many studies, protocols from other countries, mountains of data, advice and protocols from the medical experts, and as much information as we could possibly amass, most of which is changing on a daily basis. It has taken a painstaking number of hours to run a fine comb through all of this information and sift and adapt this considerable data to our school environment to ensure that the operating procedures at our school are of the highest standards. Now, returning to school has undoubtedly been very different to what we recognize as normal school. And there are many factors that have been considered when carrying out the risk assessments, the planning and implementation of all our protocols. I think most of you have seen the videos on Instagram and Facebook and understand that the moment your child comes through the gates of Al-Falah College, there are going to be very strict guidelines that have been set out in order to enter the green zone. The task team at Al-Falah College have been very particular in how we maintain these protocols. And please understand, it's not there to frustrate you or inconvenience you as a parent, but it's there to keep your child safe and everyone else safe as well. We have recently had the privilege of having the Department of Health, the Ahmed Al-Qadi assessment team, Sister Firoza from City Hospital, to come and evaluate and audit our protocols. We wanted them to find the holes that we have in Al-Falah College, that we can plug them and get as close to perfect as we can. Our plea to you as parents is that we can control protocols inside the school, and we ask you to help us maintain protocols outside the school. Another plea to parents would be, there is so much of misinformation out there that results in fear and anxiety, and most times you can disperse information faster than we can receive it. So please confirm information before posting on groups and social media. We want you to know that the health, the safety, the well-being of our children, their families, and our staff, it rests at the heart of all our decisions we take at Al-Falah College. I know no one came here to listen to me this evening, so I would like to introduce to you our first guest speaker, Professor Moosa. Professor Moosa is an associate professor and the head of Department of Infectious Disease at UKZN. Prof. Moosa has over 30 years experience in managing serious complicated infections, and his invaluable expertise and time is greatly appreciated. I'll now hand you to Prof. Yunus Moosa.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much for inviting me to speak. We can proceed to the next slide. I was just tasked with doing a very short presentation, and the whole purpose of this presentation is just to give people an idea of how this virus finds its way from one individual to another. If we have a fair understanding of that, then we will understand why we take the infection prevention control measures that we do, and to also reduce and allay your fears, because a lot of fear is driven by ignorance. If you know how this virus goes around, then you will understand that there are certain things that you do not need to be concerned with and other things that you do need to be concerned with. If you can proceed to the next slide. So we need to remember that this is a respiratory tract infection, which means that the virus essentially resides in the oropharynx and the nasopharynx. That is the part of the throat, at the back of the nose, and at the back of the mouth. And it is those cells that are infected by the virus, and that's where the viruses replicate. The infection also goes down into the lungs in a fair proportion of people, where it causes more severe disease. So really speaking, an individual who has the infection will spread the infection by virtue of dispersing secretions from the mouth. And how we do that is simply by talking, singing, laughing, sneezing, coughing. All of those activities result in a fine spray being discharged into the air. You don't see it, you don't feel it. Something analogous to that is when you breathe on a cold winter's day, you breathe, exhale onto glass, and you see that mist. That is moisture in our breath. In a similar way, we have these fine water particles, salivary particles that are in our upper respiratory tract that is discharged into the air. Now, the virus particles are believed to be in the fine droplets within that discharged saliva. The thing about the discharged saliva is that these virus particles then can infect somebody depending on where the virus lands. So if the virus lands on somebody that's close by, it needs to land on their mucosal surfaces, not on their skin. Lands on the skin won't cause any trouble. Lands on their clothes won't cause any trouble. But if it lands in their eyes, because that's where the mucosa is, lands inside the nose, or lands inside their mouth, when the virus particles lands in those areas where there isn't protection like that you have on the skin, it can result in an infection. That is considered what we call direct spread. Then the other way that the virus can get into somebody is that by indirect spread, which means it's where these fine droplets of particles that contain virus in them can land on surfaces. Surfaces such as the computer laptop, the table surface, telephones, cups, mugs, all of those type of inanimate objects. When the fine spray lands on those on those inanimate objects, the virus is in those particles. And when somebody touches that inanimate object, they then contaminate their hands. The contamination of the hands will not result in infection of that person. The contamination of the hands, the fear of contamination of the hands is that the individual will then rub their eyes or pick on their nose or lick their fingers. And if they do that, they've now effectively transmitted the virus from the inanimate object where it landed into a vulnerable area of their face. And as a result of it landing on that vulnerable area, can result in an infection. So your entire body is actually safe from getting infection by virtue of the skin. Sorry, no, let's stay with that side. By virtue of the skin being protective. It is the mucosal surfaces that are vulnerable, and the only way it can get to it is if the virus is carried over by your hands onto the face or lands on you by directly onto the mucosal surfaces. So the next question that will be going through your mind is, how will these particles land on your mucosal surfaces? That is directly related to the distance you are standing from the person who is infected. And it is estimated that if somebody stands within 1 to 2 meters of an individual, the spray will be of adequate density to land on those vulnerable areas. The next factor that takes into account is the duration that you are standing for that within those 1 to 2 meters. The longer you stand, it makes sense, the more likely there would be infected particles landing on the vulnerable areas, and the more likely you will have many infected particles landing on the vulnerable areas. So it is, the infection is dose related. The more of these particles land on you, the more likely you are to get an infection. The exact number of viral particles that need to fall onto a person's mucosal surface to result in an infection is not known. Therefore, we say that if you stand away from an individual more than 2 meters, you are safe because you are beyond the distance where these droplets will fall on you. If you are going to be close to somebody, and if it's going to be for a short duration, less than 10 to 15 minutes, you haven't had adequate exposure to get infected. So you can see distance plays a critical role and duration plays a critical role, because both of those two factors will determine the dose of virus that you are exposed to. Now, the other factor we need to take into account is dispersion. Dispersion is how far the particles are going to spray around you and how long will they remain suspended around that individual. The dispersion is related to the size of the room and the ventilation of the space that you are in. That's why we say that do most of your activities outside. So even if you are in close proximity to somebody, this dispersion factor is so great that you're unlikely to get a large dose. So you can see much of what we recommend: social distancing, wearing of a mask to protect your mucosal surfaces, suggesting that you spend more time outside than inside. If you're inside, keep the windows open so you maintain ventilation. Those are all responsible for creating a reduction in the dose and reducing the amount of virus that would land on an individual. Also, we constantly want to wipe surfaces. Again, reducing the amount of infectious droplets that are on those surfaces and have the risk of being carried over onto an individual. So this should create the entire background as to why we suggest the various measures that we do. We can go to the next slide. So the next question that would be coming up in your mind which is onto the next slide, is how long do these infectious particles lie around and therefore place you at risk. There's a lot of controversy within the scientific world as to how long that stays. Many of what I'm going to tell you now is based on artificial creation, so we don't really know how real this is in the world that we live in. So the factors that determine the viability of the virus is the humidity, the temperature, and the nature of the surface. The lower the humidity, the higher the temperature, the less the virus survives. And depending on the kind of surface, as you can see, cardboard and plastic, it'll lie there for about 2 to 3 days. On metal, it lies for a few hours. And in aerosol, and this has been refuted by many experts because this was a completely experimental situation that was created and is believed to stay in the air for much less time. So all of these factors take into account. So when we talk about clearing a classroom, whitening a surface, leaving it empty for a few hours because there has been exposure, we are taking all of these factors into account to reduce the amount of infectious particles that may be in that region. We can go to the next slide. All right, so when is an individual who has the infection most likely to transmit the infection? It is believed that people are infectious not only on the day they develop symptoms. It is the 24 to 48 hours prior to developing symptoms when they would be expressing infectious particles. That is probably one of the major reasons we have a major problem in trying to control this epidemic, because before people manifest symptoms, they don't even know that they are infectious, but they are dispersing the virus into the environment. So it is believed that the highest amount of virus in the respiratory tract, and therefore the most amount of infectious particles that are being emitted, are usually early on, just before the infection and at the onset of the time of infection. And then you can see that the amount of virus gradually decreases over time from the onset of the symptoms. So people are most infectious early. And it was found that the virus could not be cultured from the respiratory tract after the 8th day of infection post the start of symptoms, which means that most people will be non-infectious. They could have virus in the upper respiratory tract with the test that we use at the moment, but even if that test is positive, those viral particles are not viable. In other words, they are dead virus and therefore are non-infectious. And it is believed that usually by day 14, most people will be non-infectious. Again, coming back to the recommendation that we make, that if somebody has isolated themselves or quarantined themselves for 14 days from the onset of infection, they can go back to normal activity without any risk of infecting anyone, because it is usually beyond those 14 days, we don't consider anyone to be infectious. We can go on to the next slide. So that would now create a clear sense to you why we give the recommendations that we do. What about the risk of transmission? So I've quoted a few studies here that will give you some idea of the risk. There was a study that looked at over 4,500 people who were contacts, considered to be close contacts. And that 4,950 people that were close contacts were then followed prospectively, regularly testing them to see when they become infected and when they develop symptoms. And you will note that depending on the nature of the contacts, the risk of getting infected was higher. And what I want to draw your attention to, if you look at the household contacts, out of the almost 4,950 contacts, 946 were considered to be close household contacts. And of those 946, only 10% developed the infection. If you look at people that traveled together in vehicles, you will find that out of the 4,950, 818 were used public transport. Now remember, this is in China, where public transport is at a different level. Again, the number of people that got infected was only 0.1%. So what I want to bring to your attention is that if somebody is in a household has the infection, the risk of transmission is not phenomenal. Just around 10 to 15% will get infected. The bottom part of the slide again shows that close contacts, out of 2,001 close contacts, out of 2001 close contacts, out of 181 infected patients, only about 6% became infected. Again, reminding you that out of every 100 household contacts, just around 5 to 15% will probably get infected, and the others that are exposed to the virus will not get infected. People can reflect back onto influenza, how often you find that people within your household have influenza, but yet many people within that household are spared from getting influenza. Suggesting again, everyone that is exposed doesn't necessarily get infected, and everyone that gets infected doesn't necessarily get sick. Let's go to the next slide. So this is my summary slide. So to put all of this together, right, so transmission is related to the 4 Ds. It's the distance that you are from the person who is infected. It's the duration of time that you spend in the vicinity of 1 to 2 meters of the person. It is the dispersion factor, namely outdoors, ventilation of the place that matters. And all of those impact on the dose to which it is exposed. We need to keep in mind that the virus is actually a very fragile virus. An inanimate object is probably lasts 24 to 48 hours maximum. Most infections occur early on. Most people that are infected are infectious early on in the illness, and we need to keep in mind that the risk of transmission to household contacts is around 10%. So this brings my presentation to the end, and we'll move on to the next presentation. Jazakallah.
Jazakallah, Prof, for that informative information. Our next guest speaker is Dr. Ahmed Manjra, who to most of parents in Durban needs no introduction. Dr. Ahmed Manjra is a specialist pediatrician and an allergologist. So Dr. Manjra can take over.
Assalamu alaikum wa rahmatullahi wa barakatuh. Can you hear me clearly?
Yes, we can, Doc.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. So my task, can I have the first slide, please? My task today is to speak about some aspects of the COVID-19 infection in pediatrics. I must thank Professor Moosa for a wonderful presentation. I think he very successfully pointed out, the methods and modes of transmission and the various ways in which it can be done. So basically, I'm going to try and answer 2 questions. If you are infected, what happens? And what about children with underlying or chronic medical conditions? Next slide, please. Next slide, please. Next slide, please. So, early on in this, in the pandemic in China, it was initially thought that children were super spreaders of the infection. And we know that infection can be spread by people that are symptomatic, people that are asymptomatic, and people that are pre-symptomatic. So symptomatic people are those that have symptoms of COVID-19, such as fever, cough, runny nose, tiredness, fatigue, and so on. Asymptomatic people are carriers of the virus, but they have no symptoms at all. And pre-symptomatic people are those that are going to have symptoms, but don't have it yet, but are carriers of the virus. So early on in the pandemic, the exact role that children play in the transmission was thought to be super spreaders of the virus. However, with data that came out later from Europe and North America, this whole question of children being super spreaders of the virus has been debunked. And similar to what we find with symptoms, some people that have COVID-19 infection will be completely asymptomatic. And of course, depending on age and comorbidity and so on, some people may experience very severe symptoms of COVID-19. Similarly, you get people that are non-spreaders of the virus, people that are mild spreaders of the virus, and people that are super spreaders of the virus. And at this point in time, the thinking is that children are very small spreaders of the virus. So a lot of population-based studies have been performed so far. that indicate that children may not necessarily play a major factor in the spreading of the COVID-19 infection as we originally thought with the Wuhan cohort. We must also remember, as Professor Salim Karim said, that we are building a ship while we're sailing, and a lot of the information that we're learning about COVID-19 is on the ground, and the information may change from day to day, from week to week, and month to month. As far as I know, there's not been a single report of transmission in schools, within schools in South Africa. Yes, lots of schools have been closed down. That's because that's because teachers have tested positive or pupils have tested positive. But these infections have been picked up in the community and not been spread within the school environment. Next slide, please. So when children have an infection with COVID-19, they often have an asymptomatic or less severe COVID-19 disease than adults. We know that if your age is above 65 or 70, if you're diabetic, if you're hypertensive, if you have heart disease, or if you have obesity, your chances of having complications from COVID-19 are very, very high. In children, the majority of children that have COVID-19 will experience very, very mild symptoms. Now, that's in striking contrast to other viral infections in children, which can be fatal. For an example, a common virus that we see during this time of the year is respiratory syncytial virus, which causes bronchiolitis, and you get parainfluenza virus and many other viruses. And children usually have severe manifestations of these diseases, and even measles, for an example. But for some reason, COVID-19 has spared children. There are lots of theories as to why this is so. It may be because of immunization in children, and it also may be due to the receptor that the COVID-19 virus binds onto. It's called the H2 receptor, which children lack compared to adults. The incubation period in children is thought to be about 3 to 7 days. The range is between 1 to 14 days. And interestingly, in a survey from 25 countries with 10,000 children with cancer at risk and 200 tested, only 19 were found to be COVID positive. And all of them, despite having cancer and were on chemotherapy, they were found to be asymptomatic or had mild disease. Once again, pointing to the fact that children are spared from this disease. Children have very, very mild symptoms. Next slide, please. So children are at low risk of infection. When they do pick up infections, they are at low risk of complications. Also, children are less likely to transmit the virus compared to adults. Adults can transmit the virus to children, but it's unusual for children to transmit the virus to adults. Children with underlying comorbidities, underlying disorders like asthma, diabetes, and allergies can go to school. As far as children with cancer is concerned, I think the study which I pointed out to you is reassuring. But at this point, our advice is that if these children are on chemotherapy, it's probably better to homeschool them. Next slide, please. Next slide, please. So if children do become symptomatic, what kind of symptoms do they have? The majority of children will have cough and fever. Some of them will have dyspnea or fast breathing. That occurs in about 28% of children. And about 15 to 16% of children will have no symptoms at all. Now, this is a respiratory virus, so it will predominantly affect the respiratory tract. However, some children may have diarrhea and vomiting and may present with gastroenteritis. And I had a child last week who was admitted to hospital for gastroenteritis and was COVID positive. So even gastroenteritis can be a manifestation of COVID-19 in children. They can experience fatigue, runny nose, and vomiting, but this is only in less than 10% of children. In a case series from Zhejiang, which is an area in China, as many as 10 out of 36 patients, 28%, had no symptoms at all. So different studies have shown different prevalences of asymptomatic children, but generally the figure is around 15 to 20%. Next slide, please. So the diagnosis can usually be made by symptoms that children experience. This may be very difficult at this time of the year. As children go back to school, to daycare centers, they will experience other viral infections in winter as well. Like I've mentioned, There's rhinovirus, which can cause a common cold. There are other coronaviruses which are around at the moment, which cause common cold, upper respiratory tract infections. There's respiratory syncytial virus, which can cause bronchiolitis. There's parainfluenza virus, which can cause croup. So there are other viruses as well. There's also influenza virus, influenza A and B, and these can cause mild to severe symptoms in these children. So it can be very difficult to distinguish the symptoms of COVID-19 from other viral infections. And the only way to distinguish them is to actually do a test. Once patients experience symptoms and it's confirmed by a test, and they should quarantine for 14 days, as indicated by Professor Moosa, we need to do contact tracing and self-isolation if in contact with an infected person or a person being suspected of being positive. And of course, if the results are positive, then you self-isolate for 14 days as well. Next slide, please. So what do you do if your child does show symptoms of COVID-19 or other viral infections? And this applies to all viral infections. Of course, the first is fever control. We generally use paracetamol, or we may use a non-steroidal anti-inflammatory such as mefenamic acid or ibuprofen. Hydration of children is very important. We need to make sure they drink adequately so they don't become dehydrated, and also hydrating them adequately will also help to control the fever. We need to look for complications, and most of the complications has been respiratory complications in children. There's also a syndrome, a Kawasaki-like syndrome, which is a multi-system inflammatory syndrome. But this occurred in very, very few children. Some of these were not even COVID-positive children, and the link between COVID-19 and this particular syndrome is not clearly linked at the moment. Of course, if your child symptoms deteriorate, then you need to get medical help. I think it's also important to point out that there are no magic bullets on the market. Antibiotics do not work for viral infections. Antibiotics kill bacteria, so we do not give antibiotics for COVID-19. Cough mixtures are contraindicated in children. We do not give antihistamines to children for viral infections unless they have an allergy. So there are no magic bullets on the market. Generally, it's symptomatic treatment, fever control, as I've mentioned, hydration. There's also no evidence that the so-called immune boosters that you find a plethora of at the supermarkets and the pharmacies have any benefit in these children. So immune boosters really don't work. Don't waste your money. All you're doing is, making expensive urine. Vitamins, zinc, magnesium, there's no evidence that they work. So basically, the treatment of COVID-19 in children is generally symptomatic, and if the symptoms deteriorate, then they may need hospitalization. That's the end of my presentation. Jazakallah for listening to me.
Jazakallah al khair, Dr. Manjra. Once again, very informative. Our next guest is Sister Firoza Ali, who is the unit manager at the medical ward at City Hospital. Sister Firoza made time in her busy schedule to come to Al-Falah College and do an audit, and she will now speak to you about her walkabout at AFC. Sister Firoza.
Assalamu alaikum and good evening to all. I'm presenting the following, the protocols that the school has in place. On Monday, the 29th of June at 12, I conducted an audit with regards to school policies and protocols. I was accompanied by Shaheen, who took me through to the various entry and exit points. Upon entering the main entrance, I was screened and assessed. My temperature was taken. A non-touch sanitizer was used. A full survey form completed. This is done for every person entering the school. All learners are screened and assessed every morning. A survey form is filled in electronically by the teacher. This then gets captured onto a database and received and screened by Shaheen. All PUIs are screened. All learners or teachers that are absent are immediately red flagged. On observation, the following was noted. All learners had their masks on. Social distancing was maintained. Markings on the floor present with a space of at least 1.5 meters in between each learner. Maintaining social distancing. Outside every classroom and in the passages, hand sanitizers were clearly visible. Viewing the classrooms, the following was noted. Every desk and chair was labeled, as a slide shows. One learner was allocated to one a specific desk and chair. Learners at the front row of the class had their face shields on, including the teacher. Waste management, infection control, disinfecting and fogging protocols were all in place. Specific grades had specific washrooms allocated to them, and each learner was allocated a specific room which was clearly labeled washroom. Cleaners were visible to clean before and after each learner. Isolation room and quarantine areas were clearly demarcated and allocated. There were visible zoning of different areas demarcated. Example, the green zone, which is the safe zone, the orange zone, the POI zone, and the red zone, the danger zone. Contact tracing forms looked at was well done and fully completed. Department of Education and Department of Health was notified of any outbreaks in the school. Posters were clearly visible at all areas of the school, educating and reminding learners to follow the rules of COVID-19. Before the opening of school, all learners were taught online on COVID-19 and given an online assessment which every learner had to pass. Absenteeism protocols were in place. If a learner is absent, he or she has to produce a valid sick note. An online survey form has to be redone. Proper screening has to be done before a learner is accepted back to school. All meetings, social gatherings, and salah has been cancelled until further notice. Only online meetings are allowed presently. My audit findings was excellent. As a recommendation, all rules and regulations by the government, Department of Health and Department of Education has to be reinforced and abided by at all times, in school as well as out of school. We have to work as a team to fight off COVID-19. Well done to Shaheen and the COVID task team for all your hard work and the COVID-19 preparedness to ensure the safety of all our learners and teachers. MashaAllah and well done to the entire team of Al-Falah College. Jazakallah. Back to you, Shaheen.
Jazakallah, Sister Ali. We have now come to our main focus in this webinar, which is understanding the responses of Al-Falah College and assessing each situation. I think most of us have been waiting for something like this. I think Professor Yunus, Moosa, and Dr. Ahmed Manjra will take us through the different scenarios. I'll call out the scenario, and a response to it will be from either Professor Yunus or Dr. Ahmed Manjra. So the first scenario is scenario 1, where a learner or a teacher that's showing flu-like symptoms at school. What is Al-Falah College's response?
So do you want me to read the response and then comment on it?
I think, Prof, you've already read the response, but just to allay the fears and the understanding of what Al-Falah College does, which is in line with all other protocols, and what is the proper way and the proper response to a scenario.
Okay, so firstly, I believe that if somebody has flu-like symptoms, they should not have come to school. I think that's very important for the teachers as well as the learners to realize. If they have those symptoms, it is extremely difficult to differentiate the symptoms from any other virus, like Ahmed mentioned earlier on, from COVID. So we have to assume that in the context of the pandemic, that the viral infection that is responsible for those symptoms could very well be COVID, and the wisest thing to do is to assume that it is COVID, even though it might not really be. So firstly, both either the teacher or the learner should call in and let them know that they've developed symptoms. If they've developed symptoms at that point in time, then the preceding 2 days was probably also infectious, that particular infected learner was infectious based on what I mentioned in my presentation, which means if there was any high-risk contact. Again, let me define what a high-risk contact is. A high-risk contact is if they've spent any time with somebody for a duration of more than 15 minutes within a distance of approximately 1 meter. If they've had that degree of exposure, and based on how the school is functioning at the moment, it would be very unlikely that that type of exposure would have happened at school with anyone. But if for any reason there was some degree of breakdown and two friends sat together and had a good old chat for about half an hour, then the friend was put at risk, and then that individual needs to be highlighted as a possible contact, a possible high-risk contact. Now, the learner should actually, the symptomatic learner should actually get tested for COVID. But at the moment, the things have become so chaotic. We are probably going into a phase where if somebody has these symptoms, we don't necessarily get them infected, but manage them as we would a COVID. If we have reached that point, then we have to assume that the learner that had the significant exposure was exposed to COVID and they should go into quarantine for 2 weeks. If for any reason we've proven that that individual that has symptoms was not COVID, then they would not consider any of those people that were exposed to him as having been a COVID contact. However, the learner that was infected, that has got the symptoms, even if it's not COVID, should probably stay away from school. If it is COVID, they will need to stay away from school for 14 days from the onset of symptoms. If it's any of the other viral infections, then Ahmed might be able to advise us accordingly. But my understanding is that as soon as they get better, they can return to school.
Yeah, I think the only thing that I want to add is that with all other viral infections, the moment you're better, children can come back to school. However, with COVID, the difference is that you've got to... Sorry, can you hear me? Hello?
Yes, we can, Doc.
Okay, there seems to be some disturbance. Okay, but with COVID, you need to be quarantined or self-isolated for 14 days after onset of symptoms. So that's the only difference. So if children want to come back earlier to school, then we would have to test symptomatic children at the beginning of their symptoms to distinguish what kind of viral infection they've got. But for most viral infections will last 5 to 7 days and children can come back to school. So that's the distinguishing feature between COVID-19 and other common respiratory viral infection that we see at this time of the year.
Okay, Jazakallah for that. Scenario 2, where a learner or a teacher tested positive.
Okay, Shaheen, I think will be basically now the previous one was where they had the symptoms and they were not saying that it was COVID. Now we've got a definite COVID, which means that we followed the same process that I mentioned earlier on. Self-isolation for a duration of 14 days. If they develop more serious symptoms, then it would be highly recommended that they seek medical attention. Any of the close contacts, as I defined earlier on, would have to go into quarantine. If they develop, and they don't need to be tested, they go into quarantine. It is not recommended that they get tested. If during those 14 days they become symptomatic, then it might be worthwhile testing them. Although in my opinion, because testing services are so inundated, it might be better to just continue quarantine. And if they become symptomatic, the quarantine will start from the day they became symptomatic rather than from the day they were exposed.
Okay, perfect. Doc, we've been getting lots of phone calls or emails saying that a learner came into direct contact with a positive learner or teacher.
Yeah,
all right.
Okay. I mean, in that case, they've got to self-isolate for 14 days.
Yeah, that is correct. But what might be worthwhile doing is determining the degree of the exposure. In other words, if it was a high risk exposure as opposed to a low risk exposure. I'll give you an example. If somebody has walked past you in a corridor, the chances of them having infected you are extremely tiny. If you were out in an open field and you were chatting to somebody, and if you were more than 2 meters away, then the exposure is very little. So it might be worthwhile determining the risk of the exposure. If it was a high risk exposure, certainly they need to be quarantined. But if it was a low risk exposure, they need to be vigilant about symptoms and continue with their activity.
Okay, now Jazakallah for that. The next scenario would be where a learner or a teacher has come into contact with someone who is suspected positive and is awaiting test results. that's not, or either part of or not part of their household.
All right. So here again, we would expect the person to remain a suspect for 24 hours because within that time frame, they would get their result back. And then the individual will have to be managed. That exposure would need to be managed according to whether the person who has got the symptoms was indeed COVID positive or COVID negative. However, I need to make one thing clear to our audience is that unfortunately, the test that we use for the SARS coronavirus is not a very sensitive test. In other words, an individual can have the infection and the test comes up negative. So it would be important for them to ask a medical practitioner to assess their result and assess their symptoms and help make that decision rather than them deciding whether a negative COVID test means that they don't have the infection.
Okay, perfect. Jazakallah for that one. Our next scenario, which would be scenario number 5, if a learner or a teacher has come into contact with someone who has tested positive and is part of their household.
Again, the only reason I guess we are talking about a household scenario here is because household contacts are more likely to transmit than non-household contacts. Now, you must remember, if somebody in the household has been diagnosed with the virus, and if a learner lives in that household, we would have to consider that contact as being a high-risk contact, simply because of how we live our lives. We are all social beings, and we will probably be in close proximity with each other for prolonged duration. So in that case, and I'd like Ahmed to also give his opinion on this one. In that case, I would recommend the learner quarantine or stays away from school for the following 14 days. What do you think?
I would agree with that because that's a high-risk contact. But what if the learner doesn't become symptomatic in the first 7 days? Would you still stick with the 14-day period?
Yeah, you see, unfortunately, the reality is that the reason why we use the 14-day period is that is what we consider to be the incubation period of the virus.
Yeah.
Now, your audience might not understand what incubation period means. The incubation period refers to the time frame between being exposed to the virus, being exposed to somebody that is infectious, up to the time they develop symptoms. That is called the incubation period. So the reason we use 14 days is in studies they found that the most people that have been exposed to the virus become symptomatic within 14 days. They are outliers, but they are extremely few that go beyond 14 days. So if we quarantine for a duration of 14 days, then we're allowing the individual to tell us whether they have been infected. If they develop symptoms, we assume that they have been infected, and then quarantine will start from the time they develop symptoms for the for those 14 days. If they don't develop symptoms within the 14 days, the assumption is that the exposure that they've had to an infected person did not transmit to them. So that's the reason we use 14 days. Now, in healthcare workers, we use a shorter time. We say use 8 days. And then for healthcare workers, we say test on the 8th day. If they're negative, they can come back to work. The reason we do that is that we've got so many healthcare workers that are exposed that have to be out of work because of their exposure. We need them to get back to work as soon as possible. So we have compromised. We have taken a balanced decision that we'll take that small risk of them becoming symptomatic after day 8 and bringing about the risk of transmitting, be balancing that against the risk of not having adequate healthcare workers. But in a situation like this, it might be wise to use the entire 14-day period, the incubation period, to stay away. If by day 14 they don't become symptomatic, then we assume they did not have an adequate exposure, and therefore they are fine to come back to school.
So may I pose this question to the school administrators? These children that will be staying away for 14 days, it's a pretty long time being away from school, and that would place them at a significant disadvantage compared to other kids that will be attending school. Will the school be providing online services to continue with their education?
I'll let Mr. Ahmed at the end respond to that one. But I know as far as the primary school is concerned, yes, there is online services that are available for those that are at home. And at this moment in time, I know that our high school, we are in the process of trying to stream live lessons to the learners at home and those that are going to be affected. But Mr. Ahmed will respond to that one at the end.
No problem.
The next scenario that we have is, again, admin staff that show flu-like symptoms at school. I would say it's the same as if a student had to show flu-like symptoms.
Yep.
Exactly, but I'd like to reiterate that if anyone has symptoms, don't come to school. If they are at school and they develop symptoms, then obviously we can't help that. Then they should leave the school immediately after informing the necessary people so that we can clean up the area that they were in and investigate any high-risk contacts from that time going back 48 hours. But preferably don't come to school.
Okay, perfect. We do have the security officers and maintenance staff and so forth. If they are also showing flu-like symptoms, it's the same principle.
It is the same principle, absolutely.
Okay. Doc, we have some questions that were asked by parents. I will ask you or Dr. Ahmed to respond to them. One sec for me. Okay, our first question. It's kindly discuss the effect of wearing a mask continuously for a few hours in a day by learners with sinuses, asthma, or other respiratory ailments. And is there any adverse effects of breathing and potential blocking of the free flow of oxygen into the lungs? And if cloth masks may be a barrier?
Okay, I'll take that question. So first of all, children during the pandemic who have underlying allergies such as allergic rhinitis and asthma, parents need to make sure that the diseases are well controlled. And whatever chronic medicine they are on should be taken at the appropriate times. So it may be a nasal spray, it may be an antihistamine for allergies, or it may be an asthma inhaler. All these need to be taken correctly, need to be taken at its proper time to maintain proper control of the allergic rhinitis, the sinusitis, and asthma. There is absolutely no evidence that cloth masks or even surgical masks or medical masks have any effect or adverse effects on asthma or allergic rhinitis. There have been some sort of reports in the press about you breathing carbon dioxide and it can lead to a buildup of carbon dioxide. Absolutely no scientific evidence behind it. So it's absolutely safe for children to wear face masks, even if they've got asthma, even if they've got allergic rhinitis. It won't have an adverse effect provided you're taking your medication properly. It also needs to be remembered that face masks are not recommended in children under 4 years of age, and some people under 3 years of age. So above 4 years of age, it's quite safe for them to use.
If I may add a couple of things, you know, we are fortunate in the Muslim community. We have women that wear parda, and they don't suffer from lack of oxygen, nor do they suffer from toxicity of carbon dioxide. And I think every family have got a few of these women that dress in that outfit. So I think we should all feel reassured. The other point I want to make is that surgeons have been using these masks and operating. Sometimes operations go on for several hours. And if they had carbon dioxide toxicity or lack of oxygen, they certainly wouldn't be performing their jobs very well. So I want to assure everyone that what Ahmed has said is absolutely true. And we've got real evidence in our own communities and in our own experience that this is true.
Jazakallah for that, Doc. The next question from a parent is, I would like to ask that if a child is staying with grandparents who is diabetic or has comorbidities and is over the age of 70, what are the risk factors and what are the precautions should we take, and will it be safe for the child to go to school and come back home?
Okay, I'll respond to that. I think we need to have a very balanced perspective here. Nobody is going to say that the risk is zero. The reality is that with the child going to school and coming back home, there is a risk to everyone at home. In the same vein, anyone that leaves the home and goes outside into the community to earn a living, to get an education, to engage in different activities, social activities, etc., when they come back home, there is a risk of the virus coming back. So it's not really just the school that becomes a source of possible virus to come home. The entire surrounding area or the entire society is a possible source of this virus. And we just need to be sensible in how we deal with this. So in other words, when people come home, they use the usual sensible measures of cleaning their hands. There is no point in trying to create social distancing in a situation where there isn't anyone at home that is unwell. So we just have to go on with life as usual. And as soon as somebody falls ill, then we need to get them tested and then practice as best the distancing that we can. This virus is going to be with us for many, many months, if not a few years. So we have to try and normalize our lives as much as possible. And denying the grandparent the pleasure of enjoying their grandchild or the grandchild enjoying the grandparent would be extremely difficult to do, and it would be unfair. So we just need to use sensible measures, and inshallah we should be fine.
I think the point that Yunus is making is very poignant, that this virus is going to be around for a very long time. It may be 2 or 3 years before a vaccine is found. Second point is that sooner or later, all of us are going to get infected, whether we like it or not. 60 to 80% or maybe even more of the population will get infected because this virus does spread rapidly. So over the next few years, somewhere along the line, we are going to get infected. But we need to take the precautions, the social distancing, wearing of the mask, hand sanitizers, and try and take as many precautions as possible. But to try and, to bring life to a standstill will not work. Remember the lockdown, the first phase of the lockdown 5, all it did was flatten the curve and delayed the spread of the virus. It was not meant to prevent the spread of the virus. It was not meant to stop the spread of the virus. It was only meant to delay the spread of the virus. So all these mitigation measures that we're using at the moment basically do that and gives us more time to prepare ourselves to learn more about the virus so that we can know how to combat it.
Correct. And hopefully, again, with our fingers crossed, there will be a vaccine. And if and when the vaccine comes, then we'll be able to protect many more people.
Inshallah.
Jazakallah for that. Doc, the next question that's here is, a lot of kids are being affected since school started and most of the schools are closed. And since it's winter, won't that be a risk factor for kids? And won't it be safe to start school after winter? Does the virus spread more during the winter season?
Well, let me answer that. I mean, kids go to school every winter. And there are respiratory viruses that are on, the environment every winter. So kids do get sick more in winter. If you come to our pediatrics wards in winter, they're all full of respiratory viruses. Even some of the gastroenteritis virus like rotaviruses proliferate in winter. So that doesn't mean that life must come to a standstill in winter. All that we have now is an extra virus, the coronavirus, which in children will mimic other respiratory infections. So, you can't delay school till the end of winter, because all you're doing is you just delaying the coming of the virus. You're not going to be able to stop it completely.
Yeah, and the other point is that we have no idea how this virus is going to behave in winter. What we do know is that there'll be many more kids with upper respiratory tract infections, not because of COVID, but because of the other viruses, and differentiating people with COVID versus other viral infections becomes a huge challenge. But whether COVID is going to get less frequent or more frequent in winter, we have no idea. Time will tell.
Just an interesting thing that I read recently, and there was one study which showed this, but it's only one study and you can't make one study into science, where they actually showed that if you have a viral infection other than COVID in your upper respiratory tract, it may serve as some sort of protection against COVID. So, because the viruses are competing for receptors. So in some way, maybe the other viral infections may be a form of protection against COVID. We don't know. Only time will tell.
That's interesting, isn't it?
Yep.
So, Doc, you're saying we should all go out and get the cold?
No, I didn't say that.
Might be a good strategy.
We must stop living with fear and anxiety and, be too worried about these infections. Most children will be asymptomatic. Most children will have mild symptoms. A very, very few children, will succumb to this virus. And I was looking at the stats the other day. I think in South Africa, less than 10 children have passed away from this virus. And I forget what's our mortality at the moment. Where are we sitting at the moment?
It keeps changing. I can't remember, but we are very fortunate that this virus doesn't hit the kids the way other viruses do.
Yeah, most of the deaths have been in children, where they've had serious medical conditions. One was a premature child. In China, there was one child that had bowel obstruction and happened to be COVID positive. Probably picked it up in hospital, and COVID wasn't a direct cause of the death. So it seems as though this virus helps to get old people and tends to stay young people.
Jazakallah for that. Our next question is, schools give much more to our children than merely opportunities to learn. And if schools don't reopen, how does it affect a child's social, emotional, and mental health?
I think if schools don't open, it will affect children significantly. In my own experience, during the lockdown, the month after the lockdown, when we opened our practices, because most of our practices were closed during the phase 5 lockdown, we were only seeing emergencies. I saw a significant number of children with psychological problems, psychosomatic problems, anxiety, depression. Many of them had eating disorders, sleeping disorders. And that's because of COVID talk around the dinner table, parents talking about the disasters in other parts of the world, watching television. We're seeing the ICUs full, and this kind of breaking news on the various news channels and so on. And this had a tremendous psychological impact on children. Also being away from school, being away from the peers, staying indoors, the fear of going outside, all these things have had a significant impact on the mental health of children. So I think opening schools is also a way of alleviating some of these mental stresses and illnesses that these children are undergoing.
Jazakallah, Doc. I think we're getting to the last question that we have here. The level of epidemic risk and the vulnerability of students differs across regions and even from one school to another. And that means it won't be possible to reopen schools the same way everywhere. But taking into account that hospitals are now getting full to capacity, at what stage in the surge should we consider closing on-site school, or is that not necessary?
I think that's a question for Yunus.
Yeah, no, I think we need to be realistic. Like we said earlier on, that we'll have to try and normalize life as much as possible. And after listening to the preparedness at Al-Falah and realizing to what extent you'll have gone and how well your students are dealing with the social distancing and the various precautions that have been put in place, I'm confident you all should not have a problem. However, having said that, it's inevitable that you will have 1 or 2 kids every year and they developing COVID and the school being notified, or suddenly somebody developing symptoms of COVID at school. So we just need to be prepared for that possibility and deal with each case in its own merits. So what you would probably do is, as soon as you identify a pupil or a teacher that is positive, you would then have them go home and quarantine themselves and seek the relevant medical testing and medical attention. And then you put into effect an investigation on determining the contacts at school. As soon as you have identified, hopefully none, or at most a few close contacts, you would advise those close contacts to go into quarantine. And then you would manage each situation in its own merits. If you have a class, for example, where 2-3 pupils have become positive, you might want to send that again, not necessarily, depending on your investigation, you might want to close up that one classroom and not anywhere else. So you need to be sensible. You need to be wise about how you deal with the situation. The last thing you need on your hands is to get irate anxious parents calling you and demanding things to be done. That's when all the wheels will come loose in the car. So I think we just need to be sensible, and hopefully a platform like this will make parents realize that you have taken every precaution that is possible. Things are going to go wrong, but when things go wrong, we have strategies in place to confine it and deal with it. If we all have that attitude, we can keep the school going without any problems.
Yeah, just one more point I'd like to make, again, to put people's mind at rest. Yes, you are correct. The hospitals are full. The ICUs are full. The COVID wards are full. The high cares are full. But the pediatric wards are empty.
That's very reassuring.
The pediatric wards are empty. In fact, in the hospital where I work, Westfield Hospital, our ward has been closed for most of the last 3 months. And that's the experience of my colleagues as well. We are on chats. We have a national pediatric group. There's about 180 of us on this chat. Most of the pediatric wards in all the private hospitals have been closed for the last 3 months. And we haven't seen a surge, even in the Western Cape, we haven't seen a surge in pediatric admissions from COVID. So that's reassuring. We don't understand why it's the case, but time will tell. As I said, we're building the ship while we're sailing.
So Ahmed, is that the effect of the lockdown has had on the spread of other respiratory viruses amongst children?
Well, I've looked at the respiratory viral stats from Lancet Laboratories, and these are national statistics. And lockdown for April and May significantly reduced the prevalence of other viral infections as well, respiratory viruses. So we didn't see any viral infections in the last 2 months. Now slowly we're starting to see what we've picked up in the last 2 weeks is coronavirus, but not COVID-19. The other coronaviruses which causes upper respiratory tract infections in children.
Okay.
So the other coronaviruses are on as well, not COVID-19 only in children. Those are very minor infections. Kids get a runny nose, sore throat, fever, and they usually get better in 5 to 7 days without any treatment really.
Yeah, so like I said, we just need a sensible approach to any child that develop or teacher that develops COVID and belongs to a school. We just need to be sensible and rational about how we deal with it, and we should be fine.
Jazakallah for that, for sharing your knowledge and your time with us this evening, and for allaying some of the fears and concerns of our parents. And it is a difficult period in most people's lives at this moment in time. And this reassurance, alhamdulillah, we thank you, Jazakallah al-khair. And I think I'll now hand over to our high school principal, Mr. Zafar Ahmed, who would just do the conclusion, and he'll have some concluding remarks as well. So, Mr. Ahmed, Jazakallah.
Assalamu alaikum wa rahmatullahi wa barakatuh. On behalf of the entire Alpha community, I've just been informed we have over 630 people that are streaming on this webinar at the moment. And on behalf of all of them, I'd like to say thank you very much to Shaheen, his team, the COVID task team, Mr. Muhammad, who sort of put this PowerPoint presentation together, our esteemed guests, Dr. Manjra, Professor Yunus, and Sister Firoza, for your very succinct and simplifying what is normally a very complex matter for laymen to get their heads around. I think you've very made sense, made it easy for us to understand, and very succinctly put across a very complex thing. And it's very reassuring that we have members in our community like yourselves that could sort of bring across the message like you have, alhamdulillah. I also want to just sort of respond to the question of students who are unable to come to school. The primary school has been a little fortunate that they have the capacity in terms of their staffing to offer online together with face-to-face classes from grade 1 to grade 6. The situation in the high school is a little bit different in that my number of classes has increased because I can't keep the same number of children in the class. So where I used to have, for example, 2 boys classes, and now I have 3 boys classes. I used to have 3 girls classes. I'm going to have 2 girls classes. I'm going to have 3 girls classes. So I now have to find teachers for 6 grade 8 classes. So the workload of teachers and the number of periods they're going to teach is going to increase. So it's not possible when teachers come back to school to do face-to-face teaching and dedicated online. But alhamdulillah, we've run a few trials and experiments. We're able to live stream a lesson as it's happening in the class. And children who are absent, either just for minor illness or even for the 14 days for COVID, would be able to tune in to Google Meets and watch the lessons as they take place live in school, inshallah. We're launching the grade 12 one in the next day or two, inshallah. And once we get the grade 12 one right, we'll replicate that for the other grades across, inshallah. So really, again, on behalf of the Al-Falah community, I want to thank you all for the time you've taken in preparing for this webinar. I know it's been just 1.5 hours or 1.25 hours on this webinar, but all the time you've taken in preparing the slides and the pre-meetings we've had in discussing all of this, Allah bless you for your contribution, for your time. I pray Allah keep all of us safe, inshallah, and keep our families safe, and all the best, inshallah. Jazakallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
اللهم صل على سيدنا مولانا محمد وعلى آل سيدنا مولانا محمد وبارك وسلم. سبحان الله وبحمده سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. اللهم ربنا لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب. اللهم إنا نعوذ بك من البرص والجنون والجذام ومن سيء الأسقام. ربنا آتنا من لدنك رحمة وهيئ لنا من أمرنا رشدا. اللهم اشف مرضانا وارحم موتانا. اللهم احفظنا من بين أيدينا ومن خلفنا وعن أيماننا وعن شمائلنا ومن فوقنا ومن تحت أرجلنا يا رب العالمين. اللهم إنا نسألك حبك وحب من يحبك وحب عمل يقربنا إلى حبك يا رب العالمين. اللهم أنت السلام ومنك السلام تبارك يا ذا الجلال والإكرام. سمعنا وأطعنا غفرانك ربنا وإليك المصير. آمين برحمتك يا أرحم الراحمين.